Hi everyone, this is Dr. Diab, and in today's episode of Just What the Doctor Ordered, I will be discussing lens implants that we use during cataract surgery. As mentioned in a previous episode, at the time of cataract surgery, we remove the natural lens of your eye, which has become clouded, and we replace it with an artificial lens, which is usually made of plastic, in most cases acrylic, sometimes other substances such as silicone. While cataract surgery involves a significant amount of technical skill, experience, and handiwork, one of the most important parts of the surgery is actually the lens selection. The natural lens of the eye does a large part of the focusing power of the eye, so we have to replace it with a lens implant, or people would have poor vision after cataract surgery. However, what type of lens implant and what power we use is customized to each patient and is determined in large part by what your desired visual outcome is. There are many different types of lens implants. For example, there are monofocals, multifocals, torics, and other varieties. The monofocal implant is a lens that works best at one distance. So for example, if you wanted to see clear at distance after cataract surgery without wearing glasses, we would use a monofocal implant and select a power based on measurements we do of your eye and calculations that we run using various algorithms to best approximate giving you good distance vision without the need or with minimal need for glasses correction. However, because it's a monofocal implant, it will only work best at distance, and your intermediate and near vision will require correction with glasses. Another option is a multifocal lens implant. With a multifocal, it has circular rings that give different distances of vision. So it can give you clear distance vision and intermediate vision, and in some cases, good near vision as well. There are many different types of multifocal implants made by different companies, and they have various features, advantages, and disadvantages. Another type of lens implant is a toric implant. This is done to correct astigmatism of the eye. Astigmatism is a condition where instead of being perfectly round, the eyeball at a microscopic level is slightly more football shaped. Again, can come in various degrees depending on the person, and we would choose a toric lens power appropriate for your eye to correct the astigmatism in your eye. By correcting the astigmatism with a lens implant, we reduce the need for glasses or contact lens after surgery, and correcting the astigmatism from within the eye rather than from outside of the eye gives a more natural vision correction. Even while using monofocal lenses, we have multiple options. One of them is something we call monovision. Monovision means we correct one of your eyes, usually your dominant eye, for distance, and we correct the other eye for intermediate or near. There are other variations of this where we correct one eye for intermediate and one eye for near, and other ways that we can give you more glasses independence after cataract surgery, even while using only monofocal lenses. The different lens types have different advantages and disadvantages. Monofocal lenses, while they only work at one distance, have the benefit of giving very clear vision, usually without additional contrast sensitivity reduction or additional glares or other symptoms. In addition to that, they are covered by most insurance plans as part of the cost of cataract surgery. Multifocal lenses, on the other hand, usually incur an additional out-of-pocket fee and sometimes can give certain glares at night and cause some reduced contrast sensitivity in some cases. However, they have the advantage of giving a more natural vision correction in the sense that you can see through them at multiple distances without additional correction. This is a significant part of the cataract surgery discussion that I have with every patient. I need to determine what outcome they desire and what will be best for them. To know that information, I have to consider what kind of work they do, what kind of hobbies they have, what kind of activities they'd like to be able to do without having to wear glasses, and what things they might be okay with wearing glasses for. Every person is different in terms of their needs, and so we have to take all of those things into account. I encourage you to think about what kind of outcome you would like prior to going into surgery. Even in the best case scenarios, I usually tell people that we're aiming for 85% glasses independence. There may still be times when they'll need glasses, even if they choose a multifocal lens, for example. They may need some help with really fine print or with night driving or driving in the rain. It's important to have realistic expectations when going into cataract surgery. I hope this has given you some things to consider and will allow for a fruitful discussion with your ophthalmologist. As always, nothing I have said today should be construed as medical advice, and you should definitely speak to your ophthalmologist to answer any questions that you may have. Thank you.